people registered for today's event. So fantastic. As someone's just reflected already, it's great that people want to take the time to reflect, learn and share some great stuff with other people. So thank you so much for giving us your time today. So my name's Jen Kenwood. I'm the Experience of Care Lead for Community Primary and Integrated Care at NHS England and Improvement. And I also have the absolute privilege of leading the Commitment to Carers programme. So I'm going to be your chair for today. These sessions have really started because we've just really recognised there's been an appetite for learning and sharing some of the really fantastic practice that there is around the country. So I'm delighted that we've got the team from North Humber who are going to be speaking today. But it's also an opportunity for us to make sure you get to know some of the regional leads for our carers work today. So in a moment, I'll be handing over to my fabulous colleague, Campbell, who's going to be introducing the Humber team, just so you get to know a little bit about what he's doing within his region as well. Just in terms of housekeeping, as I said, we've got around about 400 people registered for today. So please, if you could keep yourselves on mute during the presentation, if you could introduce yourselves in the chat box, that would be great. It's lovely for us to know who's in the virtual room. We are recording the session, so if people have registered but not been able to join, we will be sending the recording link out alongside the slides for the presenters. If you have any questions during the session, if you could put them in the chat box or use the hand up icon at the top of your screen once we get to the end of the presentation, and we will get through as many questions as we can. Any questions that we don't get to, if they're in the chat box, then we'll try and summarise those and include them with some feedback after the session as well. So yes, as I say, if you can mute yourselves in the meantime, just because any background noise could be quite distracting for our speakers. And thank you again for giving your time. It's really, really fantastic to have so many people interested, passionate about and committed to joining in these discussions about unpaid carers. So I will hand over now to Campbell, who will introduce our speakers.
Thank you very much, Jen. Hello, my name is Campbell, and as Jen says, I work in the North East and Yorkshire region for NHS England and Improvement, working on the unpaid carers agenda. I've only been in post for a short period of time, so 8 or 9 months now, but one of the things that I have been really impressed with regards to work in our region is the system-led kind of nature of the work. This is very much not a health project, it's not a local authority project, it's not a voluntary service project, it's not a Health Watch project. It's all of those organisations coming together to work for unpaid carers. I had the pleasure of meeting Mandy and Gail, who are going to talk to me, who are going to talk to us today over the summer, and I was blown away by their commitment to support unpaid carers and their trust. I was particularly impressed by the forums that they've established to ensure that the voice of patients and unpaid carers was not only heard, but it had a real influence on the way that the trust delivers its care. Now, during the session, my ask of you is to consider during the presentation, what are you already doing to support unpaid carers? You may already be an unpaid carer, for example. And then what is your commitment to action? What more can we do? Possibly thinking on the lessons from the presentation today about what more can we do to bring the system together to improve the experience for unpaid carers. Now, I'm really keen that you'll be able to share this commitment, and I'm going to post a link to a Menti slide that I'd like you to add some simple words and simple statements to, and then after the question and answer session, we'll show the slide, and with a bit of luck, we'll have a word cloud that will really reflect on next steps and the commitment to action. So without any further ado, I'd now like to hand over to Mandy and Gail from Humber Teaching NHS Foundation Trust, who are going to talk to us about the work that they are doing. Thank you, Mandy, Gail.
Thank you very much, Campbell. So we'll just introduce ourselves. I'm Mandy Dawley and I lead on the patient and carer experience and engagement agenda for our trust. Over to you, Gail.
Hi everyone, I'm Gail Bradbury. I'm a family therapist in the trust, and I've got a background also in mental health nursing.
Okay, so we're going to start, if we can have the next slide, please. So this is our patient and carer experience strategy, and I just want to give you a little bit of context and background to where we've been travelling from the day this strategy was formed until up to today. So back on February the 14th, 2018, we had a workshop in the Trust inviting patients, carers, service users, members of the public, voluntary, third sector, and the public sector along to the workshop to get their views on what would you like patient and carer experience to look like in Humber for the next 5 years. So from tabletop discussions, we identified 12 priorities. I know these little houses are very tiny on the slide. So what we've done, we've picked out 5 of the priorities that really do talk about the carer agenda. So we're in the organisation, to start with, we are very much patient and carer experience. So I know this differs across the country. My role is head of patient and carer experience, not head of patient experience. So I wanted to bring that to the forefront today, because we do practice the triangle of care in the organisation. We look at patient service users, we look at carers, families, loved ones, caregivers, and we look at members of staff in equal contribution to the work that we do. So I just want to focus on 5 of those priorities that came out of that big workshop to co-produce this patient and carer experience strategy. So priority number 3, continue to strengthen our involvement with patient service users and carers in decisions about their care. So there's a whole work programme delivered, and Gail's work that she's going to talk about shortly will start to build a picture of the types of work that we mean in that priority. Priority number 4, further involvement with patient service users and carers in trust activities and influencing the organisation. And we're going to talk about the different involvement opportunities that we offer our carers and our patients, and also how we get them involved in forums. And then we've got priority 7, to expand our staff knowledge, understanding of patient service user and carer experience and how that influences their practice. Again, we have a staff champion of patient experience forum, which ensures that our staff are involved every step of the way in our patient and carer experience agenda. And at the current day today, we've got 192 staff champions of patient experience, and we have a recognition scheme for our staff champions. And within their trust lanyard, the 5 break lanyard, we take a little insert out and we put a little purple insert into the lanyard which says staff champion of patient experience. It's a visual identity so that staff in their team know who that staff champion is, but also when staff are caring for patients and their families, they know who that staff champion of patient experience is too. So questions can be asked about giving feedback on the services that loved ones or our patients are receiving, but also it gives an opportunity to enable conversations on how patients and their families can get involved within the trust. Priority number 8 is about making patient and carer experience the business of all trust staff, and that links nicely to priority number 7. And then priority 10, patient service users and carers will be at the centre of all quality improvement and transformation work. So it's the patient and carer voice informing quality improvement initiatives and actually helping us to listen to their feedback in order for them to get involved and really make a difference in trust activities. So it doesn't stop there. At this initial workshop back in February, 3.5 years ago, we reached out to the audience and we asked them if they'd like to be involved in helping us to write the strategy. So a group of individuals came forward, and still to this current day, they meet with us every other month, and Gail is very instrumental in that working group as well. So we have our local Health Watch organisations, our local carers support organisations on that working group, and we have carers and family members involved as well as patients. So it's a diverse group of individuals who ensure that we are actually making this strategy happen. because I'm all too familiar. I've been in the NHS myself for 32 years now, and I'm very familiar with strategies, policies, procedures being created. But sometimes strategies can go on and get lost on a shelf, they can go dusty. And this was all about keeping this strategy alive right from day one. So from the process of developing the strategy and the priorities, these individuals continue to meet with us and they help us to keep on track. We've got a big action plan that they helped us develop, and the action plan is now in its third trimester, and by that I mean in year one we had an action plan to deliver year one of the milestones. Then in years 2 and 3 we had a second action plan where we all got together and we further developed and evolved the actions from year 1, and now we are in our final trimester, years 4 and 5, and next year in April we're going to be starting the refresh of this strategy for the next 5 years. Next slide please. So just as the next slide is loading up, I want to talk to you about the different engagement and involvement forums that the organisation hosts. And this was a very instrumental part that came out of that strategy workshop, how people can get involved with the trust, with staff, with our services, so that their voice can be heard. So we started off with the staff champion of patient experience, which obviously, clue is in the title, it's all of our staff. And then from that, our staff reached out to their patients, carers, service users to identify individuals to come forward for our patient and carer experience forums. Because we're such a large geographical patch, it can take up to 2 hours to travel from one base in our organisation to another. We've got 71 sites across the organisation geographical patch. We have 6 health watches, 3 carers support agencies, and I know some of them are on the call today. So hello to everybody that works with us. It's lovely to have you supporting us today. We've got our carers resource, Carers Plus in North Yorkshire. We've got Hull Carers Information Support Service and East Riding Carers Support Service. And all of them attend our forums and our groups. And at these forums, we are able to open the door to offer the different activity opportunities for people to get involved with the trust and have a say. We've got our Veterans Forum, and that covers everybody within the Armed Forces Covenant. So whether you're a veteran, a serving member of the forces, a family member, a friend or an ally of armed forces, then this forum meets on a regular basis to basically network, enable people to speak to each other. So we've got members of the community as well as organisations that support veterans, such as SAFA, the British and the Royal, British Legion. We've got our Hull Veterans Hub. We've got Cat Zero in Hull. We've got lots of Hull for Heroes, lots of different organisations meeting with our staff as well, so that everybody can have that common purpose of supporting each other. We've got our regular Health Watch meetings. We've got our Humber co-production network, where all organisations that support and work with Humber get together. And I believe at last count, we had 75 different organisations that are invited to our Humber co-production network meetings, which our chief executive shares and chairs. Within that network meeting, we earn half the agenda to give everybody an update on what the trust is doing, but also we offer out the agenda to 2 or 3 organisations to come and share what they're doing. And this year in our March forum, we had our carer support agencies come and talk to the group about what they're doing. And I know East Riding Carer Support Service have developed a new digital platform to enable their carers within their geographical patch to access a wide resource digitally, and obviously that was very well contributed because of COVID. And also we had our Hull Carers Information Support Service come and talk about the Carers Champion training that they've developed at the Trust, is absolutely supporting, which Gail's going to talk about later. And then finally, earlier on this year, we launched our Carers Involvement Forum. We thought we'd got all of our forums covered, but it became very evident that there was a place for carers on their own from the patient and carer experience forums. And this particular forum has been developed to enable our staff who have got a passion to support carers. There may be a carers champion in the organisation, there may be a carer themselves, and it connects them with our 3 carers support organisations across our geographical patch, and it gives them a common place and a common purpose to work together. And then our most recent forum that we're just in development with, this hasn't actually started yet, is our Humber Youth Action Group, which is our Trust Youth Board. And within this youth board, we are going to have young carers as well as our young people who are within our geographical area to actually come along and be that board and that voice for the organisation. There will be a limited number of people on the youth board, but we're creating a youth network as well. So we'll have a big youth network support that feeds into this youth board. So it gives everybody, we're reaching out to everybody, young people who would like a voice and getting involved in the trust activities. But what will be really useful as well that we found with this group is they will be able to tell us what they want on their agenda, who they want to come to their youth board and speak to them. And it may be from a recruitment perspective, it may be young people at 11 years old that are about to choose their options, their GCSEs, or it may be young people who are moving into their next education key milestone of going to uni, and they want to decide on what university course they want to take. And it's hopefully going to be a two-way process where our staff will come and talk about all the different youth opportunities, or should I say role opportunities, because when I've spoke to young people in the past, quite often they're aware of the doctor role, the nurse role, the physiotherapist, but when you start to get to the more specialist roles, such as specialist mental health, they're not so aware of that those roles exist. So we're hoping this will really generate some interest. Next slide, please. So just to give you a flavour of some of our staff that get involved in our forums, I won't read this out directly, but it basically gives you 3 different perspectives of getting involved in patient and carer experience in our organisation. One's our Deputy Director of Finance, one's a volunteer, and one is a clinical peer support worker. And it's just giving you a flavour of what does being a staff champion mean to me. And it just brings to life the reality of getting involved. And it's not, you know, it's just giving people an alternative perspective in their roles. So we don't just have clinical staff champions of patient experience, we've got our corporate services involved as well. So whether you're in HR, finance, estates, catering, or you are in one of our clinical posts, whether you're a band 2 or you're a band 9 in the organisation, that doesn't matter. Everybody is here for the same common purpose, to support our patients, carers and service users. Next slide, please. So I've already mentioned about getting involved in trust activities. And this slide just demonstrates some of the opportunities that we're giving our patients, carers and service users. We've already mentioned the patient experience forums. Every month, and I've just been to our trust board this morning, every month our trust board meeting opens with a patient or carer story. And they are so compelling, and it really does set the scene for the agenda. So the board listens to lots of figures, analytical data, information, but this makes it all real. And I know, you know, from speaking to our trust board members, they really, really do value the board story. And the board story is always on YouTube, providing we get sent from the patient or carer. If they don't want to share their story public, then it remains off that first part of the agenda off YouTube. And then the board meeting is streamed after that so that anybody can watch it. We invite our patients and carers to get involved in research, and wow, have our research team been busy over the last 18 months, and I'm sure you all can appreciate why. Recruitment. We have some amazing people that get involved in interviewing for our staff. We always have patients and carers, as well as members of staff on our interview panels where we can for frontline posts, and also for executive management posts as well. Not only do they get a great deal of satisfaction from participating on our interview panels, But at the same time, it's just so important to come from a true value-based recruitment perspective when we're recruiting staff. Staff shortlist based on knowledge, experience, qualifications, but when it's the actual interview itself, we'll either have a stakeholder panel of patients, carers and service users to get to know that person from an emotional intelligent perspective. Are those individuals that we're recruiting, are they kind, are they caring, are they compassionate, are they coming from a nice place? And that's where those stakeholder panels come in. Or we may invite them to come and sit on the key interview panel. It depends on what clinical arrangement the clinical team have. We have recruited to a patient and carer experience governor on our Council of Governors, and we have 2 places on our Council of Governors for the patient and care experience governor, and they do work really closely with my team. We have got a really sound trust membership, which members of the public can get involved with. And when you become a trust member, that is when you are able to put yourself forward to be a governor. Patients and carers get involved in our trust volunteering. And we have now an online recovery college training platform. And we're just building at the moment a training programme for patient and carer experience, and we're going to be launching this in the new year. We have got 9 modules that members of the public and our staff can undertake, and each of those modules gives you a flavour of getting involved in these trust activities that I'm talking about right now. So it might be that you're interested in being involved in quality improvement and service transformation. So you would undertake that module on the website, on the Recovery College platform, and that will give you an introduction to quality improvement, sharing your story at Trustpod, being a panel volunteer and being on a recruitment panel, coming to a patient and carer experience forum, and so on. So this is going to be our new addition to really give people that forward information before they decide that they want to participate in a trust activity. Next slide, please. So I'm now going to hand you over to Gail, who's going to talk to you about Gail's role and where family therapy and Gail's role fits into the patient and care experience agenda.
Thanks, Mandy. So yeah, I'm going to just talk about the kind of clinical aspects of the more strategic end of things that Mandy's talked about. So how does that kind of translate into everyday clinical practice? So to start with, just to look at how we support our staff in the development of carer inclusive practice. So I'm just going to run through our training offer, which begins with a 1-day workshop, which we call Family Inclusive Care Coordination. This training came about for a number of reasons, but one really important reason was that as a family therapist, I spent a lot of time listening to families and carers talking about experiences of exclusion where staff perhaps hadn't offered the level of support they needed or listened enough, those sorts of things. And it struck me as being a bit silly to wait for the harmful effects of those kinds of things and then see people in family therapy sessions. So we wanted to develop a much more proactive approach to addressing that, and this workshop was our way of doing that. I'm gonna come back to some more detail about that workshop in the next few slides. But the other sort of baseline training that we've got that's available to everybody in the trust, and we're just working with our training department at the moment to make it mandatory for all of our clinical staff, is the Carers Champions training. Now this is an online session that was developed by our partner agencies, our carers partner agencies. And the aims of that are kind of helping clinicians to identify unpaid carers, raising awareness of supporting carers in our own services, families, communities, and to fully equip staff to be able to signpost carers to the support that's available from local carers organisations. And that works really well alongside the family inclusive care coordination training. So one focuses more on what we do inside the trust, and the other focuses on, you know, what additional support can be offered outside the trust. So following on from those sort of base levels, we have a 2-day workshop that's available to all of our staff that's more skills based. So that's helping clinicians develop clinical skills that are useful in meeting with families and carers rather than just with individual service users. Following those levels, we offer some much more specialist training. So this is actually the foundation and intermediate levels of training are actually the first 2 of the 4 years training to become a family therapist. But most clinicians just either do foundation or foundation and intermediate level, and they're sort of standalone courses. But what they provide is a much greater level of skill in working with families and carers to be able to offer therapeutic approaches for families. But importantly, one of the things I think that's been kind of acknowledged through research is that classroom-based training isn't enough to get people to work actively with carers and families. It's hard for people to translate their learning into clinical practice. So we've got a very well-developed support structure in place. And it's these people that have foundation and intermediate levels that take a lead on providing that support within their own community mental health teams. So they have a lead role in developing family and carer inclusion in their teams, through providing supervision, consultation, and I think most importantly, co-working. So they actually go out with care coordinators to meet carers, and that allows opportunities for modelling ways of responding to things. So sometimes care coordinators might get a bit worried, you know, about not having answers to questions and things. And it's just having somebody alongside with a greater level of confidence that can demonstrate ways of responding to questions where there perhaps aren't any answers. Many of those people also trained to that level are staff champions and are actively involved in Mandy's work, the forums at a more strategic level. So things like each team having a patient and carer experience plan. Lots of the people that have been through this training will be involved in developing team plans within their own teams that then feeds back into the wider strategy. So I'm going to talk a little bit more now about the family inclusive care coordination training. So could I have the next slide, please? So firstly, one of the things that we're trying to do is to get people thinking in this training about identifying carers. And we start the training workshop with an exercise that invites people to look at a kind of clinical case example, but we invite them to look at it through the eyes of a family member position that they occupy. So whether they're a partner or a child of someone or a parent or whatever they are, we ask them to think about the scenario from that perspective in the first person and to have a conversation with it, and then there's an exercise that builds on that. And the reason why we do that is because we want to generate the kind of emotional engagement needed to change attitudes and beliefs as well as behaviour. So if it's just a kind of behaviour change, it might drift back if it doesn't fit with the prevailing culture. And what we're looking to do is to change the culture of services so that people see the value in engaging with families and carers. Very often people suddenly see themselves in a different light through this and realise that they would be seen to be a carer where perhaps they hadn't thought of themselves in that way before. And also just acknowledging that some people don't want to be called a carer, don't consider themselves to be a carer, they just consider themselves to be a partner or a sibling or whatever. And it's about helping staff to still engage with them and support them without them needing to define themselves in that way. So it's a much more inclusive approach. So once we've sort of helped people to think about who carers are, we want them to take a really proactive approach to engaging with carers and family members at the start of the care journey. So we don't want staff to be waiting for carers to contact us and flagging themselves up, particularly when they've sort of got to the end of their tether and have felt excluded and are not happy with things. We want right at the start to be identifying who's in that person's support network, and then to begin that process of working in partnership with them that continues at every point through the care journey. And the other thing to highlight in terms of identifying carers is the move away from a kind of next of kin approach, where there's a carer that is recorded for whatever sort of bureaucratic purposes. This is about who's in this person's support network, and whoever's in the support network is part of our care team and needs to be included and invited in. Can I have the next slide, please? I'm sure everybody here today will see this as a really big issue in terms of carers and services, the issues around confidentiality and information sharing. I know it's been sort of identified as an issue nationally, but locally it's also been reflected as a key theme arising from serious incident investigations and complaints, examples of when things haven't perhaps been as they should have been. And this was one of another key reason for setting up this one-day workshop, was to really kind of help people with this. And I think that's what we've noticed, is there's a number of different reasons why this has been problematic. The first one, I guess, is just poor understanding of the distinction between confidential information and general information. So we noticed that the language tend to be about information with carers. So clients, service users were getting asked, do you want us to share your information? And if they said no, thinking it was confidential information, that's then excluded staff from sharing any information at all. And that's been very problematic. And I think that there's been a lot of confusion and anxiety created through most sort of clinical professional trainings, being very clear about not breaching confidentiality and professional codes of conduct. And that can leave staff feeling quite anxious and uncertain when there's carers asking for information, and just helping clinical staff to be really clear about this distinction between what's confidential and what's general is incredibly empowering for them. So rather than just erring on the cautious side and saying, oh, sorry, we can't tell you anything that the person hasn't given their permission, the staff can be more confident to share general information about how the person's getting on. I guess most times service users have given permission to share confidential information as well, but where they haven't, it's really important that staff know that they can still share and should still share general information, and that's not breaching any kind of confidentiality. The other influence on this, I think, is the sort of legacy of individualised models of care that historically in mental health we've focused on the individual service users and focused on a kind of holistic model of care for the service user. And now, of course, there's been a shift over more recent years towards including carers, including family members. But that's, again, another aspect of culture change that staff have to learn to appreciate, that perhaps having done a training that's focused on the service user, that it is and should be part of their job to also work with carers and families. So that's quite a big shift as well. Could I have the next slide, please? So the sort of final aspect that I wanted to highlight of this one-day workshop is just about the contact meetings with families and getting across to clinicians that this is the care team. We've got the service users, we've got the professional helpers, but we've also got families and carers. And if we haven't got families and carers in our meetings about the service users, care and so on, we haven't got the whole care team present. So it's really important that staff understand who they need to be including in clinical conversations, and that must always include invitations to families and carers, which is of course a requirement of the care programme approach, but one that's perhaps not been attended to in the way that it should be at times. So we encourage staff to understand the benefits of really listening to carer stories, hearing and understanding what's already been tried with the problem, so the professionals don't just replicate what carers have already tried and create confusion and frustration. We want to hear from a carer's perspective what they think needs to happen, what they're worried about, what concerns do they have. And that collaborative conversation then enables us to co-produce care plans for our service users with everybody's perspective taken into account and everybody's needs taken into account. And we actually ask the clinicians to role play these meetings in the training so they can have some practice with them, identify any points that feel difficult or create uncertainties and check them out in the training. So it's about understanding and creating a context that allows for the combined expertise of the professionals, the service users, the carers, the family, to get the best outcomes for everybody. And helping clinicians to understand the benefits of these meetings so that they don't just see them as, oh, another thing to do or a kind of drain on resources, the benefits to everybody. So things like learning from those who know the service user best. Carers know their relatives better than we're ever going to, and it's really important to take their perspective into account and learn from them. It's important not to duplicate caring roles. If family members are already doing something and they're perfectly happy with it, there's often not a need for service users, for professional carers to do the same things. Importantly, I think when there's some sort of serious problem in a family, some sort of mental health problem or a crisis situation, families can feel really quite immobilised and paralysed by the situation. And at those moments, they might be thinking, oh, well, we just need a professional to come in and do this. We can't do it. Or they might even be feeling like they've messed something up or contributed to the problem in some way, which can be really, really paralysing and difficult. So it's getting the message across to clinicians that what we're aiming to do here is to come alongside families and support them, not take over, so that we're looking to remobilise their resources and allow them to get back to having their relationships, their support relationships in the family. It might be that that includes taking over for a short period of time if people have just had enough, but the difference being that's a negotiated thing and not something that's just done to people. So that they get left feeling even more disempowered and perhaps reinforcing ideas that they weren't able to do it, or they weren't, up to the job of caring for their loved one. And we know from research that working in partnership with carers creates much better risk management, and as a result of that, less complaints, less incidents, and less staff time spent processing those sorts of things that could be spent in clinical care. Just the last thing in terms of these meetings, we've developed some resources to assist in carer inclusion and support. So one of our community mental health teams developed a carers pack, which contains all sorts of information that's useful on things like the care programme approach. It includes things like who's in the team, what roles people have, and team processes. So carers obviously are often saying, they had something to contribute but didn't know how to contribute it. They didn't know who to contact or how to contact. So we want them to have that information up front and to know the processes that teams use, so they're empowered to be part of that. Those carers packs have now gone out to all of our CMHTs in mental health, and they're being used by all of them. We've also developed a really simple carer stress tool, which is just a checklist that prompts staff to think about carer stress and to have that conversation with carers, where they're just sort of simple scored on a number of questions, and that helps the process of assessing carer needs and referring for a carer's assessment if stress is identified. It also helps with signposting to our excellent carer partner agencies. And our sort of strategic approach to reminding staff of these things is we use practice notes, which are sort of electronic memos that go out to relevant clinical staff, where a problem area is identified and what action they're asked to take in relation to it. And so we've had practice notes that encourage staff to identify carers, to record carers on our clinical systems, and then to regularly review carer stress levels and to act on them. And could I have the next slide, please? So this is just a quote, some feedback that we had from the father of somebody that we were working with. I won't read through it, but it's on the slides when they're circulated, and I think it just shows the value really that carers put on partnership working and how important that is to them. So I'll hand you back to Mandy.
Okay, thank you. Next slide, please. So this final slide just gives the flavour of how we learn from our patients and carers. We obviously involve them in a number of trust activities, but it's really important that they have a purpose and we have an offer for them when they get involved. So by listening to their feedback, and that can be from any of these vehicles that I've put on this slide. The Friends and Family Test obviously is the big NHS test survey that we get the most qualitative information from. And we have a dashboard in the organisation called our Friends and Family Test dashboard. Every member of staff in the trust can access this dashboard on the homepage of our intranet, and it takes you straight into the feedback from the test. And what we've done is we've evolved the dashboard so that it's split into two. It gives us what patients and service users think of the service they've received from the trust. And then the other is what carers, families, loved ones think about the services that have been provided as, within their caregiving role from the trust. So it just gives us both sides of the coin with regards to, is it good or are there improvements to be made? Staff morale can be boosted, is boosted. when they receive good feedback off the dashboard. But obviously there's lessons to learn where there's improvements to be made. Some of those boxes we've already spoken about, but it's just basically to share with you all today that we don't just involve people for tokenistic lip service. We involve them so that we can listen to their lived experience, really appreciate what people are telling us so that they can get actively involved in co-production. More recently, we've developed a co-production logo stamp in the Trust, and this gives all of our staff instant, at a glance, has that work been co-produced? So have patient service users and carers worked with our staff as equal partners to produce this piece of work. They've designed their own logo, and we've got a process where a member of staff will complete a form on our intranet. It comes to my team so that we can see the evidence of the steps they've worked through to ensure that true co-production has taken place. Then we reward the team with the stamp, and it's within our Trust branded guidelines now, so that that stamp goes onto that piece of work. So, and the idea behind that is it first of all gives my team an opportunity to see which teams are really valuing co-production and working with patient service users and carers on with their work, and which teams do we need to further explore and share what co-production means and how we can get them involved. So we really get that, you know, that idea, that appreciation of where co-production is really happening and where my team needs to go in and work with that team to support them, to basically share with them good practice. Co-production, so important. Okay, I think that's the final slide.
Thank you so much, Mandy and Jill. I mean, that was really comprehensive and great, and we've had a lot of activity going on in the chat box while you've been talking, some of which I know, Mandy, you've responded to, but just in case people have missed bits, because it's easy once that starts tracking down, I'll go through some of the questions, but I think just to reflect initially that that's just such a positive example of how you've really embedded culture change in your organisation, and absolutely not lip service. It is really robust. I think the breadth of your staff engagement was absolutely fantastic. You know, the representation in different core functions of your organisation, so including people in interview panels, things like that, absolutely fantastic, and something we obviously also do. So it's great to see it happening with you guys as well. And I was so heartened to hear you moving away from the next of kin approach as well. Something that has been really problematic for years. And I think particularly in terms of things like end of life care, where we've seen some really families that have been through very difficult times, and next of kin has absolutely not been the right person to be the person that you've then sort of got in contact with it at difficult times. So really good. So just in terms of what's come up in the chat box, someone had asked if you had a vignette or a sort of description of that carer champion role that you might be willing to share.
Well, I've just noticed in our chat box, we've got Julie Barn in the room, and Julie is one of the partner organisations that we work very closely with. Julie is Hull Carers Information Support Service. So it's actually bringing what we've just been talking to life. And I'd love to welcome Julie in the room because she developed the Carers Champion training that our Trust have embraced. And we are mandating it. I know that was a question in the chat that I noticed, that we are mandating it for all of our clinical staff to undertake. I know that the question was about the training, and I didn't want to answer the full question because obviously the family therapy training that is Gail's team. But Julie, did you want to talk about your Carers Champion training that you developed?
Absolutely, Mandy, thank you. The Carers Champion training was developed following, I work for the Carers Information and Support Service as part of CHCP, and we'd spent an awful lot of time raising awareness of carers, what an unpaid carer looks like. Apologies, my phone's rang. Always would do, wouldn't it? So we'd spent a lot of time and focus on raising awareness of carers. And what we learned quite quickly is it only went so far. And on an own personal experience on arriving at some hospital interventions for my father as a carer, I was really pleased to see carers information on service support on notice boards and leaflets. And what we did, but actually nobody actually spoke to me about being a carer or involved me in my dad's care. So ourselves, Mandy and Elaine from East Riding Carers talked about wanting to push it to that next step and really embedding it in a way of thinking. So we wanted services and frontline staff, receptionists, etc., to really have an understanding of what an unpaid carer is, and actually be able to offer that support immediately for them information, advice and support services that are available locally. So what started off as something that was, you know, but for Hull really, has quickly developed into something that's available across, champions are available across Hull and East Riding, right across the Humber Trust, and in our colleagues with Scarborough, Rydale and Whitby, across North Lincolnshire really, and it's been really well received. Our carers champions don't just complete a training session and have a much more increased awareness. They actually take it back into the workplace too. So these are the people who are updating their notice boards, who are talking in their team meetings about carers, or are doing exactly what Mandy's presentation is talking about. Is changing cultures. It's being able to actually say we don't just recognise carers, we think carers. So from, like I say, from raising awareness, knowing about what support's available, recognising carers, but actually thinking carers in pathway designs and within their own organisations and services is something collectively we're really proud of. It's, you know, I'm really watching this, Mandy, your presentation today. I was right at the very beginning when you set out your priorities and your objectives, and it's great to see how you've achieved them. It's really, I'm really proud. It's good.
Well, all I can say is it's teamwork, Julie, it really is. It's the fact that we've got such wonderful relationships with our local carers organisations and our health watches, and, you know, it's just the whole, I think the whole culture, like we've already mentioned, and the different forums where everybody comes together. I know, Julie, I don't take for granted all of our organisations that support us, because people like Julie, they're coming to lots of meetings. They're coming to all these different forums, but like, I'm so grateful because 3.5 years down the line, they're still coming. And, you know, we're nearly about to refresh and they're going to be involved in the refresh. But obviously, it's a bit like I say, it started off like a little snowball and it's got bigger and bigger and bigger. And we've now got a massive snowman of all the people that have come on board on the journey. So I'm just excited to see where the next 5 years goes.
Well,
I like your style of snowman.
Collectively, we're about to hit in 1 year, and it's only been 1 year because we launched it on Carers Rights Day last year. It's over 600 carers champions across our organisations. It's perfect. It's absolutely perfect, and it is like Mandy says, the mandatory approach is welcome, because what we do know is carers are accessing all our services. You know, it's so relevant. It's generic. We need to really think carer. But thanks, Mandy. Sorry to jump in.
No, that's great. Thank you. And again, I think it just sort of adds more proof to the pudding, doesn't it? That it is genuinely working together and it's not doing things to or for people. It is about that really cohesive partnership, which is absolutely fantastic. In terms of the questions, there's probably two that we can link together. One was around how do you make sure you get the sort of diversity of carers involved? And you'd commented about sort of seldom seen and heard groups. Someone's asking who in particular were you finding as the people that had been more excluded?
Yeah, and that's a really good question. I mean, what I did right from day one of starting in my role, I reached out to all of the different groups for me to attend. It's one side me creating all these forums and inviting people, but you know, I studied relationships when I was at uni, and what factors affect leadership relationships to influence change. And the biggest thing of all for me is relationships, emotional intelligence. So it's networking. So I'm a member of the LGBT Forum, the local equality and diversity groups, the East Riding Carers Advisory Group. I try and get myself involved with the wider communities. We've got a newly established BAME network in the area where we've got a BAME coordinator. And the one group that was missing for us and the participation, which I know somebody had put in about young carers in the chat box, I noticed. We knew we had something missing, and that was young people. Now, our young people's services, we have CAMS and we have 0 to 19s physical health services as well, health visitors, school nursing. We have got basically in the trust, we have every service within our portfolio apart from acute. So if you just imagine everything from primary care to secure services, children's mental health, adult, older people's mental health. We've got 8 GP practices. It's a huge, diverse array of services that we provide. Young people, yes, our CAMS and our young people services do connect. They have patient groups, parent groups, young people's groups. We recently built a new inpatient unit for children called Inspire. And the children created the name and they were very heavily involved in that. But from a strategic point of view, there isn't enough for me with regards to getting that strategic voice into the organisation. So the Humber Youth Action Group, it's been co-produced. We started co-production back in April of this year in the Easter holidays, and we've had the young people coming on board ever since to share how they want their young person's group to look. And I feel that's a group that's missing, and that's what we're doing. We're bringing them in. So wider communities, we're still trying to connect in the best way we can. And by me going out there and networking, so I have been doing for the last 4.5 years, whenever we have workshops, we have events, we need feedback. It's not about that consultation, it's about bringing them in. So I go out to my networks, I offer the opportunities and I bring them in. Obviously, it's been a little bit different for the last 18 months because we've been in COVID, but everything's virtual now. Even our trust chaplain that I manage, so I'm fortunate that I've got the EDI agenda, so it's the golden thread leading through all of this. I try my hardest not to talk about EDI separately, because for me it's the golden thread that everybody is one. I didn't create a separate EDI strategy to a PACE strategy because EDI, they are our patients all within the strategy. Everybody's one. So our trust chaplain started to do virtual church services back in April of last year. Soon as COVID hit us, it's one of the first things we did. Ever since then, they've taken off. And our Lord Mayor of Hull comes to every service, and Hull has a Freedom Festival every September. The Lord Mayor and Eve jointly open the Freedom Festival now virtually. Our Hull Pride got cancelled twice. Physically on Queen's Gardens in Hull. So we created Pride in Humber Week, and Eve opened up the service with Pride in Humber, and we call it Pride in Humber now. And we have real lived experience coming to talk to everybody on these groups. So we're just trying to reach out differently. We know there's digital poverty out there. We know that it isn't the answer to everything, but it's just trying to do our best to work with what we've got. But obviously we know there's loads of work still to do, and I'm not going to sit here now and think we've cracked it, because I know then there's no reason for me to be around in my role. We have got lots of work still to do, and we're on a journey, and our next strategy will be our next chapter of this journey, where we'll start to reach out. We'll look at where our gaps are, and our next strategy priorities will be those gaps. I hope that kind of answers it in a loose way.
Thanks, Mandy. I'm conscious that we're down to our last 2 minutes, so do need to draw to a close. I have a list of questions here, so please don't think we've ignored your questions. If you put them in the chat box, we will send them on to Mandy and Jill and include some feedback for you when we send the slides out as well, if that's okay with you, Mandy and Jill. Because there were lots of really good questions and a really nice reflection actually from Debbie in Surrey that around confidentiality, that actually even if you can't say something doesn't mean that staff can't listen to what carers are saying. So actually there are ways of including people differently. But we will make sure all of that stuff is shared. Thank you so much for giving your time, energy and effort to do this presentation. I don't underestimate the work that's involved. It has been absolutely inspiring to hear everything that's been going on. So really good to have that. I'm sure we'll have to bring you back for something else again, because I feel there are loads more questions we want to ask you. So I will say goodbye, but I'll just hand over to Campbell for the last word. I caught him on mute now. Sorry, Campbell.
I'm aware we're right at the end. So what we've done is I've got your commitments on a slide. I've posted them in the chat box, but what we'll do is we'll add them to the slides for today's session. And I just wanted to say thank you to Mandy and Gail. It's not only is it interesting, I would argue it's inspiring. So with that, I think we should bring it to a close. Thank you.
Thanks, everybody. Look forward to seeing you again next time. Bye-bye.
Thank you.